Acid reflux happens when contact from your stomach goes all the way to your esophagus, and it leads to so much discomfort. This is called acid regurgitation or gastroesophageal reflux. If you have such symptoms that occurs at least twice a week, then we are leaning towards disease, which is called GERD, which is gastroesophageal reflux disease. In today's health exchange chat room, we will discover the following. What is acid reflux? How is it different from a heartburn? We'll talk about what are those signs and symptoms. We'll talk about the risk factors, what are the causes. We'll talk about the management, home remedies and treatment, and we'll definitely debunk the myths that are out there. Hey, I'm Dr. Babs. Welcome back to my YouTube channel, Living at Your Finest with Dr. Babs. Thank you so much for tuning in. I appreciate your support. I appreciate that you're investing in your health today. Now, do me a big favor. Make sure you subscribed if you haven't. Hit that bell so that whenever I have a new video, you are first on alert. Share with friends and neighbors so that we are healthier together. The whole goal is we want to make sure that we are taking care of the root issues and not just using medications as a band-aid. You know what time it is? Yes, time to hop into the exchange chat room where we have a guest waiting on us to answer questions on acid reflux. So I have a wonderful sister in the health exchange chat room with us today in person of Nelly Ogbeni. She is a wonderful, wonderful sister, very busy, pleasant lady. And so I really appreciate your time. Let me give you a little bit of information about her. So she co-owns a publishing company with her husband. So I'm going to make sure I put some information so that you can check it out. She's a mother of 3, and she's very active in her community. She's a co-president for the PTA. So I really want to thank you for your time today, but let's jump right in. I'm going to tap your brains. I'm going to find out what you know about acid reflux.
All right, let's do this. So nice to have me on your platform, and congratulations on this beautiful, beautiful platform of yours for reaching out to people and bringing topics that a lot of people have questions about and they really don't have answers to. So with your background as a doctor and also like a health, I won't say fanatic, but like you're really, really into health and running this and that. So I am so honored to be here.
Thank you. Thank you so much.
Yeah.
So acid reflux, it is so common. I mean, it's the worst thing that can happen. Experienced it before. And I was just curious, do you know what it is when somebody says they have acid reflux or heartburn? It comes with different names. So what do you know about it?
I just know it's a very uncomfortable feeling and it makes you so uneasy and it feels like you're burning like on your chest, that goes all the way maybe to your stomach. So, and I know my mom suffers from it on and off.
Okay.
And I'm not so sure completely about it, but I think some foods might contribute to it.
Mm-hmm.
And I don't know. Some people think it's genetic, but I don't think it's genetic. So, so I'm here to learn.
Awesome. Well, I'm glad that you gave us your own idea and sense of it. I'll definitely talk a little bit more about specifics, but you're right about the burning and the uncomfortable feeling that you get with it. And I'll definitely debunk the aspect of whether it's genetics or not. Definitely some foods can trigger the acid burn, but do you know why it even happens in the first place? I know you said some foods trigger it, but do you know what's going on in there in the pipeline? So you eat, it goes down to the esophagus, to the stomach, but do you know why that's happening by any chance?
Well, you're the doctor, so I'm
Okay.
just tell you what I think.
Yes, that's all we want to know,
you
what
know
you think.
yeah, so I'm sure maybe there's some irritation, maybe the
Absolutely.
mucus, like the membranes or something to do,
Yeah, got
you
it.
know. So, and I think I've heard,
Hmm.
especially when I was expecting my kids, I was told you have to sleep on one side. more often than the other side. So
Yes.
the left side, because of the way you sleep and the acidity, the bile or whatever it is, will kind of
Yes.
erode, your stomach. You know,
Yes.
I think there's some irritation, most definitely based either on your lifestyle,
Mm-hmm. Mm-hmm.
live your life, and I'm not sure because I know some very healthy people, but they still suffer from, acidity,
Mm.
you know,
Yes, very good.
and
I think you
have,
hit the nail on the head. Definitely,
mhm,
absolutely. So, irritation, there are things that you can do to prevent it, like you said, which side you lay. And so, I'll definitely show those pictures. So, I just have two more questions for you.
okay,
Since we know that food could trigger it and some of our lifestyles, I guess automatically, let's avoid those things, right? And it should
right,
help. But my
right.
question is, what other treatment measures are you aware of that might help? So we know avoid some of those foods. I don't know if you know one or two foods that you've heard, but in addition to that question, what medications have you heard, like maybe over the counter or prescription that might help with acid reflux?
Okay, so I think, is it Zantac?
Okay, yes.
Zantac sometimes, I've heard it works, but to me, I think is a temporary fix
Mm,
to like a really maybe either deep issues, because a lot of people use medication, to, I know several who just
yes.
be popping pills, for instance, if they have like a lot of peppery food, they have a food maybe rich in uh, tomatoes or something,
Yes.
or when they eat like a lot of pineapples or oranges, just something. So some of them
Mm-hmm.
take milk. I've had
Mm,
milk calms the stomach down a little bit,
yes. Yeah.
and yogurt, and I think it's Pepto. It's not Pepto Bismol. Pep.
Pepto-Bismol, or which one are you talking about?
There's another one where this guy normally advertises on TV. It comes in a purple box.
Oh, the Nexium, the omeprazole.
Yes, maybe that. Yeah.
Yes, it's
But
always known as the purple pill.
right, right. And I also heard if you have like foods rich in acid when your stomach
Mm,
empty, like if you take a lot of oranges when you have not eaten food, or you take like all these acid rich foods when your
yes.
stomach is empty, then it doesn't help at all. It just makes it.
Hmm. Okay, definitely. Great. So those are great insights. Definitely, I will debunk all of that. I really want to thank you for your time, and I want to give you an opportunity to ask me any questions that you think will help better sense of what acid reflux is. Definitely, one thing that I'm going to dive in a whole lot about, other than what you had said about how you sleep, is also when we eat and we go to bed.
Oh,
That's a big one. So I'm going to talk about it. We eat and then we go right to bed. So there needs to be a certain number of hours. But do you have any questions that you would like for me to debunk when I go into the discussion room?
yeah. So like, for instance, are there foods you're supposed to eat at the beginning of the day that's supposed to prevent you from, having acidity for the rest of the day? Like, are there
Okay.
that kind of will coat your stomach,
Yes.
kind of like a soft pillow, quote unquote,
Okay.
for the other foods that you're gonna have for the rest of the day.
Okay.
You
Good.
know,
I like that you even said coat your stomach. So you know that it needs a protective layer. Okay, good.
yeah, because I assume it's a really sensitive,
Mm-hmm.
part of the body. And I
Right.
also want to ask that some people think, I think Africans especially that I've known, older,
Mm-hmm.
younger, that a lot of if you have a lot of acidity in your stomach can lead to ulcers. So it's
Mm.
like acid can burn a hole through your stomach or through your, the mucous membranes around.
Yeah.
So I want to know if that is the truth and what we can do to prevent that.
Absolutely. I love that. Great questions. And I will be more than glad to debunk it in the discussion room. Well, I want to thank you again for your time. I really appreciate you. Thanks for being an advocate for your health and being a woman health champion in your society.
I'm trying to be like you. Thank you so much. So much.
Oh,
I love your work, and just kudos to everything that you're doing.
thank you. And right back at you. Gastroesophageal reflux disease. is a chronic condition that affects the digestive system. While most people might experience heartburn, meaning that, you're just having some discomfort, some indigestion from time to time, if this is occurring more times than often, like twice a week, then you have what we call GERD, which is the acid reflux disease. So it's a little bit more than just indigestion. The advert that they say indigestion, diarrhea, and all of that. That's a little bit more than just that. You actually have a disease. Now, this could be really serious. There's several complications that occur if it's long lasting because of the exposure of acid. But it is very important that we understand that the acid that we're talking about that comes from the stomach, it's a good acid. It's a good thing that for us to have because it aids in several functions in the body. Such things as it helps to sterilize our food, it helps for protein digestion, it helps to activate all the necessary hormones that are in the GI tract to digest our food. It also helps to stimulate the bile and enzymes. It helps to close the splinter, the esophageal splinter. So several good things come out of the stomach acid. Now, when it's too much in the wrong place, that is where we have the problem. According to the National Institute of Diabetes and the Digestive and Kidney Disease Association, GERD was estimated to affect 20% of people in the United States. And if left untreated, it could lead to several complications. Complications such as esophagitis. So this is the esophagus right here, just right after the mouth pipe, you have the esophagus that leads to the stomach. It could have strictures, right? You could have inflammation. All of this is because prolonged exposure to the digestive juices. We could have what we call as Barrett esophageal problems, and this is where you have just damage to the lining of the esophagus. So it all starts from the esophagus. You can have cancer. Cancer, of course, is when you have abnormal changes in the lining of the tissue. You could have asthma worsening. You could have chronic cough. Some people say they're hoarse when they wake up. I have a patient, always hoarse, always sounding like he ate a frog. Chronic cough that wakes you up at night because of all that acid reflux, all the irritation, as my guest had mentioned. Just have all that irritation taking place. Breathing problems sometimes. What about the teeth? You could have damage to the enamel, the tooth, the erosion, gum disease. Lots of things can happen. And these are things that we can definitely avoid if we do not lower this risk. Now, I want to talk a little bit about who this affects and why it affects them. Now, studies have shown, to give you a little bit more data, that in 2014, we had about a 15 to 30% increase. And not only that, in late 90s to the very earliest 2000, there was a 216% increase in hospitalization from acid reflux. And 62% of these people that were hospitalized were women. So very, very common in women. It could happen to anyone. But why does this happen? That's the question we should ask, right? So what happens is that, as I mentioned, you eat from the mouth. You have the pipeline called the esophagus that leads to the stomach, right? So what happens? The lower esophageal splinter. So it's a splinter that is a circular band of muscle that ends at the esophagus. So when it's working well, it will open and close, right? You eat, it drops, and it closes. But if there's a weakening of that muscle, then you have acid reflux occurring because you have the acid refluxing back. I mean, it's as simple as it is, as it sounds, right? So the acid reflux happens when the lower esophageal splinter does not tighten or close properly. So this allows for the digestive juices and the content to go back into the esophagus. Now, what are some of those risk factors? You remember there was a question that my guest asked, that is it hereditary? Concluded that yes, it might be. It might have a genetic component. Not all forms of acid reflux could have a genetic component. Some are suspecting that, the splinter being weak might run in a family. Or is it just that the way most people eat in the family is similar, so there's some environmental factor. So it's still not clear about that, but based on data, they have seen some association. Now, anyone can develop acid reflux. It can occur in any age group and ethnicity. However, we need to know what leads to the weakening of the esophageal splinter. Overeating eating so fast, not chewing your food. That has happened to me. Oh my gosh. And it was the worst feeling ever. I felt like there was a frog in my throat. And now I empathize with patients that complain of acid reflux. Being overweight, unfortunately, having increased body mass, pregnancy, that's added stress on the body. It does do that. Eating large meals, so not just overeating, but large meals. Lying down right after a meal, you really need to give about 3 to 4 hours between your last meal and when you go to bed. As you can imagine, you've gone to bed, you haven't given your splinter enough time to close, so all that acid is reflecting back. Certain kind of foods have been known to cause this problem. So beverages, spicy food, tomatoes, peppermint, soda, which other ones? Yeah. So some people are more predisposed to these foods and are very sensitive. Alcohol has been shown, smoking, or even secondhand smoking. Isn't that crazy? Now, hernia. If you've heard of hernia, it's called hiatus hernia. That's where you have a small opening and then you have the stomach actually protruding through the diaphragm. So you have the diaphragm that separates the chest from the abdomen. So if there's a small opening, then you have going through the hole and causing all that reflux. Certain medications, so like NSAIDs, especially if you're eating on an empty stomach, NSAIDs like naproxen, ibuprofen, aspirin, there's some painkillers. So there are a couple of medications that are culprit for this acid reflux that tends to happen. So we definitely need to be very careful. When we go back to food, we talk about a lot of citric foods, things like that have been, known to cause acid reflux. Now, what are some of those symptoms? I've already alluded to some of them, right? Like coughing, hoarseness. Some people actually have chest pain. I don't know, if you heard about, I'm trying to remember the well-known actress that she thought it was acid reflux, but she was having a heart attack. So it tends to mimic a heart attack because it feels like something just sitting out on your chest. But if it's not getting better, you definitely need to see your doctor. Either way, you need to see a doctor. But in terms of distinguishing between if it's acid reflux or heart disease, medication, like if you use any of the medications we're going to be talking about, does relieve it. But if it's a heart attack waiting to happen, you wouldn't notice any difference. So those are some of the symptoms. Some people might be gaseous. Some people might have bloating, difficulty sleeping because you just have that difficulty with the acid. You're really, really irritated. Okay, there are some atypical symptoms that you would see. Gum disease, they could have bad breath. Yeah, because you have a lot of acid, difficulty swallowing, and that's where it gets really, really bad and you're not able to swallow. How do we diagnose acid reflux? It's a clinical diagnosis, it's a thorough history, it's a thorough physical examination. Make sure you talk to your doctor, okay? Don't sit on it. If it's getting worse, it's not getting better, have that conversation about why you're feeling the way you're feeling, all right? Now, again, clinical diagnosis, good history taking, we'll figure out what makes it better, what makes it worse, when it does it come on, things like that would be important questions to ask, and what triggers it. All right. Now, some of the complications that we want to avoid, as I already mentioned, the cancer and all of that, we need to make sure that we need to do some diagnosis. So have that conversation with your doctor. Some diagnosis would be like barium swallow, and that's where you just take a solution and then they will do an imaging to see if there's any obstruction. You could also have what we call upper endoscopy. So they'll put a flexible tube with a tiny camera to see if there's any like damage of the lining of the esophagus or even the stomach wall. There are other things they can do like the pH monitoring or manometry. All of that would just see what's going on in the strength of the esophagus muscle. So tons of things can be done. There are blood tests if you are checking for H. pylori. Is when you have a bacteria that has invaded the stomach lining and causing a lot of increased sensitivity to the acid. So that could be checked through a blood test or a breath test or a stool test. Again, have the conversation with your doctor. If you're taking over-the-counter medications or you're trying your best to avoid those, triggers and it's still there, then they can definitely check for that. Now, what are some of the home remedies? All right, let's talk about a lot of the home remedies. I am all about prevention. When I was having my own bouts of acid reflux, again, it wasn't a disease because it was less than twice a week, because I quickly addressed what I was doing, eating very fast, going to bed, and shortly after eating. So there are things we can do to prevent needing to take medications. What are those things? Of course, behavioral modification. So quit smoking. I know it's not easy, easier said than done. If you need help, there's help. Just talk to your healthcare provider. Trying to lose some weight, no matter how little it is, it makes a big difference. All right, eat smaller meals, chew, take breaks, pause, chew. That makes a whole lot of difference. Some people say chewing gum after eating. I don't know. I don't know about that. When I chew gum, I think like I feel like I'm swallowing gas. So everybody's different. All right. Now, what's about sleeping? Remember, my guest had talked about which side to sleep. Studies have shown that if you actually sleep on your left side, your stomach actually is on the lower side, it's at the bottom. So gravity will return all the juices to the bottom, right? Versus if you lie on your right side, then your stomach is higher up, and then that has the tendency to reflux back into the esophagus. Definitely avoid all those foods, right, that trigger your symptoms. Not everybody has sensitivity to certain foods. You know what yours are. So the common ones, again, I will say them: peppermint soda, caffeine, let's see, tomatoes for some people. So you want to definitely avoid those. Avoid wearing tight clothing. Those are very, very, very important. Now, stress. I have tons of friends that's all their trigger: stress. Stress plays a role in acid reflux. It's crazy that just being stressed, especially when we eat, we're not in our relaxed mode. So the acid is just in a hyperactive state that it's refluxing back, and the splinter is not calm enough to close. So we definitely want to pay attention to eating when we're less stressed. We want to breathe in and out, take our time so that we're not stressed. You want to do more of liquid than solid food when we're stressed. So definitely practicing stress relieving techniques will help. Breathing techniques will definitely help to reduce the stress. Apple cider vinegar, one of my favorites. I love me some apple cider vinegar early in the morning. How does it work? It works because it's a natural acidic acid that helps to reduce the pH of the stomach environment, and it also activates the vagus nerve, which turns on the production of the stomach acid, bile, and pancreatic enzymes, and it helps it work more efficiently. So it helps your all these enzymes, it helps to digest your food a whole lot better. So definitely there's several ways that you can use it. You can put it in your food. You can drink it before your meals. You can sip, which I always have it with my dressing, my foods. That's my dressing for my salads now and my stew. My morning primer, I add it to warm water with lemon, and I enjoy it just before your meal. Definitely helps. And this answers the question that my guest asked about, that what are those things that you can do in the morning that would just keep you straight the whole day. So apple cider vinegar has been shown to be one of those, and definitely paying attention to what those meals are that trigger, and then making sure that you're not eating too fast and you take your time not to eat while you're stressed. Some fermented foods have been shown to be very helpful. Some, like kimchi. I've talked a lot about these foods in other videos. So you want to make sure, like coconut milk has been shown to be good. Make sure you pay attention to the sugar content, right? You have grass-fed dairy if you get dairy, and probiotics. Again, is one of those that help to improve the microbiome in the stomach. When you have improved bacteria in your stomach, you enhance your acid production. There are some herbal remedies that are out there. I have tried chamomile, and that is very soothing for sure. So know that some of these have side effects and can interact with some medications. So please talk to your provider, your healthcare provider, about these. Now, in terms of treatment, right, there's several options that will help to prevent and relieve symptoms of acid reflux disease. So talk to your doctor about these. But note that these also because they have side effects, you don't want to rely on them as a band-aid, right? Because you're only just taking care of the problem. You're not going to the root of the issue. So you want to make sure that you're aware that some of these things like antacids, over-the-counter antacids, or H2 blockers, when we say H2 blockers, so it's just blocking the amount of acid that you're producing, or we have what you hear, the proton pump inhibitors. So a lot of people have heard about the purple pill, Zantac, Pepcid, Prilosec. They're all under the same category, all reducing the amount of acid, but ultimately in the process of doing that, you can cause another problem. So because of the way it reduces the acidity, it can decrease the absorption of other things that take place within the same body. So what am I talking about? It has been shown that you can decrease calcium absorption if you take the NSAIDs for a long period of time. Studies have shown and evidence is proven that vitamin B12 deficiency can occur, which we know that leads to anemia, depression, fatigue. It can also lead to iron deficiency. That's if you're taking it on a long-term basis. I mentioned calcium deficiency, so bone loss, muscle spasms, vitamin A deficiency, and that will increase, inflammation. So even though, yeah, we have these things in terms of medication that can help, you do want to be careful, all right? Because it can help reduce the acid, but in the process, do too much good and affect the way that other pertinent things in your body is absorbed. So very important to note. Well, I think we've come to the tail end of our video. Thank you so much for hanging in to the very end. I hope I haven't caused a heartburn now with all the juicy information that I've shared. I hope that you found this video to be helpful. Thank you so much for tuning in to the very end. Please share with others, right? So that we're healthier together and we can prevent all these chronic diseases, because we're empowered now with knowledge and we know how to speak with our healthcare provider and ask the right questions. Don't forget to subscribe again, hit that bell so that you never miss an episode on anything health related. Until next episode, remember you need to live at your finest holistic health because you deserve to and you most certainly can achieve to. Have a wonderful week.